Hi, I'm David Harrison. I'm a lawyer, and I want to talk to you today about side effects of baclofen and why the discussion about side effects really is a bit of a red herring. So, the issue arises when you discuss this treatment with baclofen treatment for alcoholism with people who tell you that they have taken baclofen and that they find the side effects to be so great that they don't carry on with the treatment. And I've also had discussions with doctors who have said that they would not use baclofen in treatment of alcoholism because of the side effects. So it's a fairly major issue, and it comes up quite frequently. And when you take baclofen at high dose, the side effects are things like somnolence, fogged brain, sleep apnea, which is can be quite disturbing, and disorientation. I suppose you have a sense of not being quite with it. Your thoughts are slowed, and just because it's a muscle relaxant, it slows you down. It can make you appear to be under the influence of alcohol. So, so it's not always the best of looks if you're in a job that requires that you're alert. So that's the gist of it. Some people find that quite disturbing. Also, in terms of sleep apnea, what you find is that you can be in bed having taken a dose, and your breathing slows down to the point that you don't know when you're going to take a breath in again. And because you are so relaxed, it's almost difficult to actually even try to breathe in. So what you find is that your breathing slows down considerably, and then after a while the instinct to breathe kicks in and you take a breath. And that can be quite disturbing if you've experienced it. So anyway, so here's how I want to break down the issue. So first of all, you've got to look at how people diagnose themselves with alcoholism. And then what I suggest is we look at the different groups of people who would take baclofen for their treatment, and why they would find the side effects to be distressing, and whether the actual discussion over side effects is actually something that can be dealt with and looked at from in a different way, which might be helpful in treatment of those with a real need for baclofen treatment. So most people will diagnose themselves with alcoholism. AA suggests to people that they, if they have an alcohol problem, the first step towards cure is to admit that they have an alcohol problem. And so, and the same goes with doctors. They'll look at DSM-5, which is a diagnostic manual, which sets out when one is considered to be suffering from alcoholism or substance abuse. And these are things that you look at yourself, and you tell your doctor that you suffer from, you're not keeping up with your your work life, and you might be getting into trouble with the law, although that's not in DSM-5, was in DSM-4. But it's, that you take a large amount of alcohol and that you have an inability to stop drinking and that sort of thing. So these are all self-diagnoses. And so you'll find someone, both with the AA approach to things and with DSM-5, you find people who diagnose themselves as alcoholics because of their behavior because of their alcohol consumption, and not because of any sort of actual medical examination or tests, blood tests, or any sort of intrusive examination of their body or their brains. I mean, maybe they have liver tests, for instance, and they're told that they have liver damage or problems with their liver and their kidneys. So if you can break it down this way, you will find people who diagnose them, who decide that they are or describe themselves as alcoholics because they have a number of issues in their lives, such as drinking heavily and having all sorts of problems arising out of that, such as hangovers and difficulty sleeping or anger management problems. They may be drinking at work. They may be taking a bottle and keeping it in a drawer. They may be having long lunches. They may be drinking every day. They may be having binges every so often. And these are people who may be also, in this first group I want to discuss, people who are actually still holding down jobs, are still able to function. So although they may feel that their drinking is problematic and it may be quite serious, they're still able to function. So these people are looking for a treatment which will allow them to continue their employment, continue their existing lifestyle, and they wouldn't be in a position, for instance, to take several months off to go into rehab. And they certainly haven't been diagnosed with any sort of medical ailment which would account for their drinking, because in fact there isn't any such tool for discerning whether someone has a neurological or physiological problem which results in them drinking. So these people would perhaps go to their doctor and ask for online, ask their doctors for Baclofen and start on a treatment. And what they would find with that is that, as we know, you start with a low dose of Baclofen and you gradually work up the dosage. And what they might find, for instance, is that they're having difficulty at work concentrating, that their speech might become slowed, their reactions might become slowed, they don't enjoy the sleep apnea, and it's taking quite a long time for the alcohol consumption to drop off. And certainly they get to a point where they feel that if they drink any more or take any more Baclofen, that it could have very serious effects on their employment, for instance. And it's something they just don't enjoy, so they cut back and decide it's not for them. So these are people who aren't particularly getting into trouble, let's say, with the law. They're still working. They feel they're drinking too much. They feel it's become a problem. They've given themselves a diagnosis as being an alcoholic. And they find that the treatment isn't for them. And it may be that actually, if we knew their full medical situation, we're able to peer into their physiology, we'd find that they don't have the anxiety disorder that Dr. Mason talks about in his book. So if you look at these people, they will say, and their doctor might say, well, the benefits of it, in that you're able to work even though you consume alcohol and you consider yourself to be an alcoholic, the benefits, the risks of this drug, or which are the side effects, having side effects, in this case, are worse than the illness itself, because it hasn't helped you terribly much with your alcoholism. It's causing you worse problems than the alcohol did. So these people will say it's not for me. So there you have a group of people who, a cohort, let's call them, of people who, let's say for the sake of discussion, these are a group of people who don't pose any great threat to public order. They don't commit crimes. They're ordinary people who have jobs and are able to function. So there isn't huge public interest, let's say, in making them take the treatment. The doctors don't feel particularly concerned about their treatment to get involved in persuading them to take this, or to put them in a few tests. So what you have to see if they actually do have something which responds to Baclofen. As I say, there really isn't anything they can do anyway. So these people will say, it's not for me, and they'll come off it. And so for these people, the side effects are significant. But from a public health point of view, how important is that? Because, for instance, if you're talking about people who are able to function and have access to medication if they want to, they can get Baclofen, they could get Camprel, they could get a prescription for now, if they want to, Nalmefene or whatever the generic name is for it these days. So it's available if they want to take it. They don't pose a threat to the public. And so from a public policy point of view, these people aren't a priority. And this poses a problem because this group of people will be probably the largest cohort of alcoholics and those who are most able to become engaged in the discussion over Baclofen treatment because they're still functioning. And they're also generally going to be people who are holding responsible jobs and whose opinions will be listened to. So, leaving them aside for the moment, you then move to a different cohort of patients. And these are people who have gone beyond that, who are no longer able to work, no longer able to properly function. And perhaps you might have someone who, for instance, has had a long history of alcoholism, which has resulted in family breakdown, loss of job, is perhaps receiving some sort of state benefit, and really is unable to function in any way which most people would consider to be a normal way, and have been confined more or less to their homes, have become reclusive and drink excessively, perhaps a liter of spirits a day, until they really can't function as normal human beings. And sometimes these people go on to, develop liver cirrhosis and other issues. Now, these are people whose lives tend to be disorganized. They may have got themselves in trouble with the law, with drunken disorderly issues. They may have lost their driving license, driving under the influence of alcohol, and are often isolated or live with another alcoholic. Now, these are people who become a burden on the state because they're claiming benefit. They're unable to work. They may find themselves in hospital with issues to do with their liver. They may be in hospital because of injuries sustained while under the influence of alcohol, falling down, breaking their leg, for instance. They may be a burden on the state because of their involvement with police and the courts. And so these are people who put a considerable amount of strain on society. And these are people whose alcoholism does give rise to public health issues. So when you have people like this, you have a number of problems that arise out of this. And these are people where you would say that the effects of their alcoholism are extremely severe, such that when you talk about side effects such as somnolence, bearing in mind that these are people who in many cases sleep away the day and rarely go outside except to buy food and alcohol. So these are people for whom side effects like somnolence would be really irrelevant, rather insignificant, and other effects such as inability to concentrate at work, fogged brain, really have absolutely no significance in terms of considering baclofen side effects before a doctor gives them a prescription. So in this case, using side effects as a guidance as any guidance in terms of prescribing, really is a waste of time and hugely inappropriate. And with some people, their conditions may be so serious that they're in all sorts of difficulties, legal difficulties, difficulties with the police, and where they become such a difficult proposition for society to deal with that many actually end up in prison because of things they do under the influence of alcohol. And they just create all sorts of problems. And for people like this, in some ways, it would be, I think, wrong to consider side effects as any sort of basis for deciding whether they should receive baclofen, certainly if they consent to it. Now, the issue in the case of this cohort of patients isn't really to do with side effects. It's really more to do with management of prescriptions, delivery of the medication, and diagnosis. Because what you find with people in this situation is that they have difficulty engaging with professionals. They have difficulty getting to see a doctor. And their conditions are often so serious that they're unwilling to disclose their true level of alcohol consumption. So, for instance, you'll find that they only rarely see a doctor, and when they do, it's when they've managed to keep their wits about them and sober up long enough to get in to see a doctor for 50 minutes. And so someone like this is going to sometimes not be entirely honest, and may in fact be downright dishonest about their condition, and maintain, for instance, they don't have a drink problem at all. And so it becomes very difficult to get them to engage in a medical treatment. And for a lot of these people, they are so far gone that they won't really have any idea of the treatments available or be able to engage in any meaningful way with a doctor. So for these people, it's very difficult to get them prescribed. And even if you were to prescribe baclofen, it's a very difficult drug to get people to take, because the success of baclofen rests on the ability of the patient taking it to maintain a regular dose, so as to stabilize the level of baclofen in their bloodstream. And so they have to take it at regular intervals through the day and through the night. And if you could imagine that somebody has a drink problem, which makes them reach for alcohol as soon as they wake up, it's difficult to see how they can engage in a regime of pill-taking, medication, self-medication, where they have to take the drug every 4 hours or sometimes less, and keep it at a certain level. Because you may find, for instance, that by 10 o'clock in the morning they're passed out in bed, and so they start missing doses. And so even if they try to take the medication, bearing in mind that the dosing regimen allows them to continue drinking while they increase their dose, titrate up, they haven't stopped drinking. So at low level, you may find that they simply aren't able to get very far with the titration regime. And they may still continue to tell their doctor that they're doing quite well, even though they're not. So it's very difficult to get these people to go up to a high dose. And what you may find with them is that the power of the alcohol over them so is so strong that they really can't engage in this treatment successfully at all, because their lifestyle is so erratic and out of control. Now, having said that, it's quite common for people with this level of alcoholism to be very successful with Baclofen, but it's not without difficulty, if I can put it that way. And it's not unusual for people with severe alcoholism to relapse into alcoholism. And it's very, very easy, because it's very easy to simply forget to take a dose and then to reach for alcohol and then go straight back into drinking and be unable to stop again. And quite often people in this situation will say it's much more difficult to get back into Baclofen dosage the second time around. So in my paper, which is in the link below, I've dealt with this issue, because in other instances of substance abuse, such as heroin addiction, in some countries like the United Kingdom, there are programs which are run through the courts, which will require people who are convicted of offences where there's where the drugs involved, where there's a drug problem, where the accused has a drug problem, will require them to engage in drug treatment programs. So if you can use an analogy, that is an analogy. There's no reason that one couldn't, that a country couldn't pass legislation to require alcoholics to engage in treatment, medical treatment programs for alcoholism, if their behavior under the influence of alcohol was such that it weighed heavily on the public purse, for instance, and caused them to commit criminal offences. Short of that, there's very little way of getting people to comply with dosing regimes. And the only thing that really can be done, and the best thing in the case of people in this situation, is that they have someone who can help them with this.